Hello, my name is Nicholas Cohen. I'm a doctor in Cleveland, Ohio, and I'm here to share with you the top 10 tips to lower your blood pressure. Tip number 1, lose weight. If you are overweight, then losing weight is the most effective way for you to control your blood pressure. You can tell if you're overweight by asking your doctor for your BMI, your body mass index. You can also Google BMI calculator online and use an online calculator to calculate your BMI. If your BMI or body mass index is over 25, that means you're overweight and you would benefit from weight loss. Tip number 2, eat less salt. The goal is to eat less than 1 teaspoon of salt a day. Most salt that we eat comes from packaged and processed foods and food from restaurants. Processed foods include prepared frozen meals, canned foods, pickled foods, snack foods, lunch meats, condiments, sausage, and dressings. So to eat a low-salt diet, choose fresh foods over packaged or prepared foods. If you buy packaged foods, make sure the label says low salt. And finally, don't add salt to your food at the table. Tip number 3, eat a DASH diet. DASH, which stands for Dietary Approaches to Stop Hypertension, includes 2 main dietary guidelines. The first is to eat 4 to 5 servings of fruits and 4 to 5 servings of vegetables every day. Tip number 4, the second part of the DASH diet. Eat 2 to 3 servings of low-fat milk or dairy products each day and avoid saturated fat. This is the second part of the DASH diet. Saturated fats are found in butter, in red meat, and in many desserts. Low-fat or unsaturated fat is good for you and is found in olive oil and canola oil. Tip number 5, exercise. You should aim to have to accomplish about 30 minutes at least of physical activity every day. And this doesn't mean you have to go to a gym, and this doesn't mean you have to be drenched with sweat at the end of the 30 minutes. So what I do is I go bike riding for 30 minutes a day at least. You might find walking more convenient. Whatever you do, it's important to do it for a total of 30 minutes each day, every day. Tip number 6, don't overdrink. It's important not to drink too much alcohol because drinking too much alcohol can raise your blood pressure as well. For men, you should not drink more than 2 drinks or 2 servings of alcohol each day. And for women, you should not drink more than 1 serving of alcohol each day. Tip number 7, stop smoking. Although smoking itself doesn't raise your blood pressure over the long term, smoking causes an increased risk of heart attack and stroke. And heart attack and stroke are already increased in people who have high blood pressure. So if you already have high blood pressure and you smoke, then you dramatically increase your risk of stroke and heart attack. Tip number 8, see a doctor regularly to manage your blood pressure. It's important to have regular follow-up with a physician or another healthcare provider to make sure that your blood pressure is well controlled. If your blood pressure is well controlled, it's recommended that you see a doctor just to make sure that it's still well controlled, at least every year. Tip number 9, take your blood pressure medications every day. If your doctor has prescribed blood pressure medications, it's important to take blood pressure medications every day as directed by your doctor. A lot of people have trouble with blood pressure medications because when you have high blood pressure, a lot of times you don't feel sick. So people don't feel better when they take the medications. But when you take the medications, you dramatically decrease your risk of heart attack and stroke in the long run. So it's extremely important for you to take your medications every day. And tip number 10, believe in yourself. You absolutely, positively can control your blood pressure with lifestyle changes, with help from your doctor, and with medications. Thank you for your attention, and good luck.